out either way. There's a number of different ways we can work with this area here. So as I press up along here again, I might do, again, I may already have an idea from having done an intake and assessment and so forth, okay? So as I press up along here, not really a big deal.
Not too bad, no.
Okay, all right, so we may end up just going through the motions here. All right, so let's say we found something kind of tender somewhere here along the side of his rib cage. And typically it's going to be very close to that midline along the lateral side of his rib cage. Could be just below the rib cage also, might be down, you know, some people might notice more.
There's a little bit there.
Oh, yes. All right, so we've got something to do. But what's going on down here? So we've got lateral, we've got those nerves, lateral cutaneous nerves of you know, coming out here. But this is also actually down in the area of the 12th rib. So we may also possibly deal with iliohypogastric. Okay, there's several nerve options here. Does it matter that I know exactly which nerve it is? Not really. Not really. Okay, if one intervention isn't going to do the trick, we've got some other ones we can explore. But I'm going to stay with this one for the moment. All right. So a couple of options. I may have him rest his hand up here, his elbow up here. Okay, and sometimes one simple functional test is that I'm going to have you keep your elbow straight. I want you to have you just go ahead and try to raise that up overhead. Now some people, now he's got good excursion here. Okay, some people, they're going to come up, it's like, and it's going to stop. Okay, and if that's the case, we're just going to have him right there. All right. So, how many people have seen something like this before? Okay, most of you in some fashion, right? The old cross hand. Okay, now I can certainly use my Dyson. I can use my Dyson down here to anchor and just my hand up here, or I could certainly use a piece of Dyson either way. Or I could use both pieces. Okay, but I should be able to hang out here for a while if I want to. If I position my hand strategically, okay, I should be able to go in there and test. Okay, do you still feel that there?
No, it's okay.
So it feels somewhat better already. Okay, so depending on your hand placement, you should be able to go in there and test that same spot. You know, so typically if I find a spot, I try not to break contact with it as I'm getting myself in position. And sometimes that means I have to get a little bit creative. But so we can test it out. So this is one position that his arm could be in. Well, what if he's got frozen shoulder? You know, we might have to have that up here. We might have to have it, you know, we might have to have it really supported, right? Okay. We're going to want to make sure that his shoulder isn't feeling, you know, that his shoulder is going to be able to tolerate whatever. Okay, but can I still do this? Heck yeah. You know, I'm just going to, his shoulder's in a different position, but there's no reason why I can't still take the skin longitudinally. Okay. So what if he's got great excursion, which he does, okay, but there's this area still sensitive? Well, I can have him up here. There's no reason why I can't do some variation on that, okay? And I can still check in with that same area, okay? So these three things, here, and here, and here, they're the same thing. Just the arm is in a little different position, okay? So don't get too caught up on the differences between them. It just depends on like how comfortable and mobile his shoulder's feeling, okay? Okay, so subscapular nerves of trauma. Okay, so subscapular, where is that?
Under the scapula.
Under the scapula, deep to the scapula, right? So we're going to go right in behind the scapula and dig them up, right? Maybe, okay. Or we can do this the nice way. So there's a number of different ways that we can do this. So it does, for this, it's not really going to matter what side, but I'm going through, you know, again, if I'm skin to skin, I can get that nice skin to skin adherence. But since I've got fabric here for this, I'm going to be more likely to use the Dyson. And what you'll often find is that when you put Dyson on fabric, for some reason you can get such a much better grip on the skin below the fabric. It's really cool.
Magic.
All right. So here's the thing: is that if you'll notice up in here, you know, it shows my arm cupping this. Okay, when I'm thinking subscapular, one of the things I can do for that subscapular area is I can try to put it in more of a position of ease. What does the subscapula do? If we're talking, yeah, it helps draw the scapula back, which contributes to lateral rotation, right? Okay, and this, right? So, if his arm is here, where is his scapula? It's rolled forward. Okay, it's flaring a little bit. Okay, you don't have like a big winging scapula, but it flares a little bit. So I'm going to take it out of flare. Okay, fewer pieces of flare for you. All right, so now I bring a scapula back into a neutral position. Okay, now it's laying nice and flush against this posterior rib cage. So the subscap itself is already in more of a position of ease. Now, if I want to do a little bit, provide a little more happy sensory input for the nerves, I'll plunk this against the back of the scapula. I'm just going to allow gravity to draw my hand down towards his spine. Simple, simple, simple. Okay. And so from here, I'm just going to hang out. And so before I apply this, though, where might I check him to see if he's tender? Where might we check? We're talking subscapular nerve.
Armpit?
Could be, yeah.
Terry's.
Could be along in here.
Oh, that's a fun spot.
Could be along here. Okay. Could be on either side of the scapula, wherever people typically dig in to get subscap, right? So what am I going to do? Well, so you said this was.
Yeah, that's just a great place.
All right. So let's allow that to come up. Okay. So we're going to let that just kind of drape against my arm, against my body there, and take the skin down. Okay. And I'm not forcing it. Just make contact and let it sink. I can let my knees soften a little bit too. I'm not going to have to exert myself to make this happen. Here I'm just resting on the surface. Am I pressing here now? Is that still tender?
No, it's not. Not too bad at all.
Okay. So that's all it took. Simple, simple, simple. And I can press in there easily twice as much pressure. No big deal. Okay. So you'll have a chance to do that with your partner. And let's talk about the pectoral nerves. Still in the sideline position. And with the pectoral nerves, okay, perfect. So this will be our final one for this bout of practice. So we did variations on this, okay? And we brought this up. We drew the skin back here, okay? So where would we palpate though to see if there was something related to pectoral nerve? Yes. Okay. You are learning my pattern. Okay. So if I press, okay, no big deal. You got some pecs on you, man.
Thanks.
All right.
Sometimes I let
So, all right. So, and of course, everybody loves when you go, into pec minor. It's not that bad,
Not
though,
too
is
bad.
it? Yeah.
Shockingly.
It is kind of shocking. Okay.
Yeah.
So here's the deal, though. He doesn't have to be in a lot of pain. I'm gonna go through the motion. If your partner may find some stuff that I'm not. Okay. But here, what am I gonna do? How can I put skin stretch into this area? This is gonna come up. The arm's gonna come up. We're gonna draw that away a little bit. There we're already drawing pecs out a little bit, but not like a big pec stretch. We're not doing that kind of thing. I'm thinking more skin stretch than muscle stretch. If I want to extend his arm, I can. It doesn't have to. What I'm more interested in is I want to take this skin up towards his elbow. Okay, and I'm just gonna draw the skin up. And now you'll be able to feel a change in the surface tension of the skin. If I want to, I can have an anchor hand closer down here, okay, closer to the sternum, so that I can draw the skin in opposite directions, okay? So now here's a guy, and here's a guy with some pecs, right? Okay, lots of women have pectoral tissue too, right? Breast tissue, okay? Okay, some women have quite a lot, some not so much. Can we do this with women? Yeah, yes we can. Okay, what's going to be really key to doing this with women?
Staying with prosthetician.
Communication, setting expectations. And yes, if you as best you can, you know, not going where you're not supposed to. Do I want to touch nipple when I'm doing this?
Probably not.
Not if I'm here for the right reason. Okay. So,